How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hello, disruptors. Welcome back to Disruptive Dialogue, where we bring you information you need to be an informed consumer of U.S. healthcare, as well as providing insights to what is hurting our U.S. healthcare system and how we can make it better. Today, I'm super excited. We're diving into a topic that almost everyone will eventually face: navigating a hospital. Whether it's for yourself or for a loved one, stepping into a hospital can be very overwhelming. My guest today is Val Barschaw. She's the author of Surviving the Hospital: 6 Secrets Every Patient Should Know. Val is both an author and a patient advocate. Her ability to develop a systematic approach to patient advocacy comes from her professional background in both accounting and the legal fields, where she developed skills requiring absolute precision and attention to detail. The same attention to detail that caught accounting errors caught medication mistakes. The same systematic approach that organized legal cases organized medical information. And that same persistence required in legal work became the advocacy that saved her husband's life multiple times. The knowledge from this book will provide 6 essential elements that will empower you in the hospital setting. The book is intentionally short and written to be easily understood. It is a blueprint to survival in a system that too often fails patients through human error, institutional gaps, and profit-driven priorities. Val's message aligns perfectly with the mission of Disruptive Dialogue: empowering informed, motivated people to demand better from a broken system. Her 6 secrets don't require policy changes. They don't require corporate reform. They work immediately in any hospital for any patient willing to transform themselves from a passive recipient to an informed healthcare partner. Because somewhere out there, someone's about to walk into a hospital feeling unprepared and vulnerable, just like Val and Bill did years ago. This interview could put life-saving knowledge into your hands before you need it most. Val, welcome to the show.
Well, thank you very much, Chuck. And hello and welcome to you and your audience. I want to encourage your listeners to be sure to check out your website and to sign up for your newsletter, because you have done such a meaningful job at making the right thing easy. Write letters to the legislatures. You have templates right there on your website that they can use. I've used it already, and it is so easy. So you've made it simple, and I want to thank you for removing that barrier, for providing empowering resources so that together with your listeners, we can all make improvements to make our healthcare system better and fix it.
Well, thank you so much. That means a lot to me. I have to give credit. My wife is amazing. She worked on that website. She's the wind beneath my wings. But yes, I will tell you, it's exciting that you use the tools. It's exciting that you found the website user-friendly. And yes, that's one of the things I did on my previous job when I was in the corporate world was advocacy, and we had letters that we sent to legislators. And yeah, the goal is to make it simple so that anyone can do it. So thank you for validating that. Thank you, but let's get started because I know the listeners want to hear about your book. It's really cool, and everyone I had a chance to read it, so I'm excited to share it. And Val, I'd like to start with what inspired you to write this book?
Well, clearly, I was inspired by my husband, Bill. In 1990, Bill wasn't feeling well and went to the doctors, and they admitted him to the hospital, something he wasn't even expecting from a doctor's appointment.
Right.
But the cardiologist came into the room and said to Bill, "You have idiopathic viral cardiomyopathy." That's something you cannot say fast 3 times. I've tried.
True.
So what I think is very normal is Bill said, okay, so something's wrong with my heart. What exercise can I do to strengthen my heart? And the cardiologist said to him, Bill, you need a heart transplant.
Oh.
The next logical question was, well, how long? And the whole idea of a transplant just totally blew his mind. But the doctor said, how long is, you can probably make it 6 months to a year without a transplant.
Oh my God.
That totally pulled the carpet out from under his feet. So I got to tell you, overwhelm sucks. He didn't know what to do, didn't know where to turn, but luckily he did accept 2 pieces of advice that the cardiologist gave him right off the bat. One is the cardiologist told him to establish a support group, people he could lean on when times got tough. Because when you're facing a major medical situation, times are going to get tough.
Yeah.
And that's where I came in. I had not been in the picture yet, other than to know him as a coworker, but I joined the support group with a couple of his friends to be there for him when he needed someone to lean on. And the other good thing that Bill did, and he'll tell you to this day, it made the big difference, was he renewed his faith. It was what he really needed to get him through what he was about to embark on, which was a 10-year wait for a heart transplant. And that is both good and bad. It took a lot longer, but the science improved along the way. And that's one thing about our healthcare system. We have some areas in healthcare that need fixing. Absolutely.
Oh, yeah. Yep.
We also have some really swell people who are working tirelessly to improve the outcomes for the patient. So I want to say that notwithstanding, we encountered some very serious hospital mistakes. I'm not in any way tearing those people down.
Sure.
The hospital system has humans. We will make mistakes.
Of course.
The impetus of the book was after it's now 25 years of post-transplant care. And there were some obstacles along the way there too. But I went into Bill one evening, and I remember it was 2023. And I walked in to talk to him, and I said, sweetie, I need to write a book to help others get through the hospital system much easier than what we had to go through. I have no idea how to do it. And Bill was cute. He kind of shrugged up his hands like, okay. It's going to be easier than a heart transplant, so go ahead and go for it. And I kind of chuckled and I said, well, it'll keep me out of the bars and the nightclubs at night. But the point is I had his support to tackle something I'd never done, which is write a book, get it published. And now my mission is to get it into the hands of as many people as possible. So patients can know the major things they can overcome to get a better outcome. And that's what started the book, is getting Bill through all of it. And then deciding, wait, I can do more. I can help others.
Well, good for you. And I have a couple questions. Well, first off, you say about his faith, and, I don't care your religious affiliation so many times, because I've been in the healthcare industry for a long time. The power of prayer is real. It is real. And when I read the book, and I know that Bill's alive because we've spoken, I'm thinking, oh my God, 1990, and he's getting a heart transplant. I used to do orthopedic implants back in 1990. I'm like, the technology was not great in 1990 for a heart transplant. Holy mackerel, that worked for him. Now, you said it was a 10-year wait, but I also heard you say that the doctor said it was going to be, he had 6 months to a year till he needed a transplant. Well, he didn't get it for 10 years. So how did he get through that 9.5 years that the cardiologist wasn't sure he would?
And that was through the hard work and dedication of a team of healthcare professionals. So the medicines along the way were improved upon, or, for example, Bill was the first human on an experimental medicine. So
Wow.
he was willing to try and be that guinea pig to help keep himself going. And the good news is the medicine worked. And then as he continued to get weaker, they put in a defibrillator. Then he continued to get weaker still. And so next thing you know, he's set up with a heart pump that's putting an IV directly into his heart just to keep him alive. So throughout that time, we accepted any improvements that the science and technology brought. We relied heavily on our strength to persevere. That is an inner strength that people, I think, have forgotten that they actually have.
Yep.
Your inner strength is something you can call upon at any time. No one can take your spirit away from you. And so that was one of the things that got us through. We actually even had a portion of that 10-year wait where his initial cardiologist transferred him off to the transplant center hospital. And the transplant hospital had been trying everything. And one day we were in there for tests, which were routine. You're being tested all the time to see if you're
right.
If what the weak heart can keep going. What can they do differently?
Sure.
And the doctor came out to the waiting room. And so in the waiting room, the doctor looked at Bill and he said, "Bill, you're too sick. You cannot have a transplant."
Oh.
Another patient heard that. They could see the mortification on Bill's face. But the other patient and his wife were also on the transplant list. And they saw Bill's hope get dashed. And that impacted them. It seriously negatively impacted the other people in the room. So a tip, if your doctor's coming in to give you some news and it looks like it's going to be some big stuff other than, okay, we're done for the day, you can go home, ask to go to a private area to discuss it so that you can hear it well, react without impacting any other people around you. So he said, "I got to get a second opinion." Bless his heart. And so sure enough, we're back at the initial cardiologist saying, okay, they've taken him off the transplant list. What are we going to do?
Wow.
And the cardiologist said, okay, let me look at the test results. Oh, I know. We'll put you on the heart-lung transplant list because you're going to need both organs because that's the problem is, and you being in the medical field will know pulmonary artery pressures.
Sure.
Okay. So his pulmonary artery pressures were too extreme that they couldn't transplant him successfully. And so the other doctor said, ask for a heart and lung. So back we go to the transplant center. Oh, this takes time. And they said, okay, let's find some more medicines. And we actually went on to a new medicine, and that kept him alive longer.
Well, wow. So every time I talk to you, I hear like new stories and new lessons. And, it's interesting. And I'm so glad that you said that, even though, and I get on this podcast and I talk about insurers and PBMs and hospital systems, and look, you have good and bad professionals in every profession. And I will tell you, our healthcare professionals, their heart is in the right place. Their training is incredible. Their efforts are Herculean, and they are in a system that is asking more of them and giving them less. But that still being said, just like that physician who spoke and said something very impactful in the waiting room, they can handle that better. So there's a lesson for physicians, and I'm sure some are listening and, they know this. I also think that, to your point, just being able to persevere, asking for a second opinion, not accepting no. These are lessons and things that everyone needs to do in this system today, because this system today is built to tell you no, and you need to fight. And we're going to get into that. So your story is amazing. I could talk to you for hours about this, but I know everyone wants to know, okay, what can I take away? And they've already gotten a couple pearls, but let me ask you a question. A patient walks into a hospital. What would you say is the most surprising thing that might happen for a patient in that situation?
So what I've observed time and time again, the most surprising thing is the patient has an unrealistic expectation that everything's going to be perfect.
Right.
And the patient, and this will disrupt a few people, the patient needs to be more responsible. The patient needs to be more of a captain of their health.
Yeah, I love that. It's so true. You walk into a hospital and look, we all appreciate and respect and admire physicians and nurses and everything that they can do, but they're not the only ones with a job here. And what I loved in your book was you said, look, you are part of this medical team. You have the most to lose and the most to gain. So you have to be an active participant, and you should be the captain of the team. Don't put that on the physician. The physician has other patients. He has other responsibilities. This is about you. And yes, you're going to follow their instructions, their directions, their guidance, their knowledge and expertise, but you should be the captain of the team and take that responsibility. I love that. I think that is invaluable.
Yeah. And that's the number one takeaway. So I'm a bit of a numbers nerd, as you know, that accounting background thing.
Right.
And I can cite the statistics that a prepared patient, on average, will reduce their hospital stay by a full 2 days just by being prepared.
I love that. So I love that the patient, everybody, you're the captain of that medical team. Doesn't mean you tell the doctor what to do, but you are responsible. I love this. You say, be curious and ask lots of questions.
Absolutely. So if you find yourself not feeling well and being curious, asking questions, remember that by being prepared, not only are you going to get better answers, but you're also going to gain respect. The medical team appreciates you for taking the time to write down, gee, when did these symptoms start? Write down when the symptoms started. What were you doing? Is it better or worse in certain circumstances? Is it better before you eat? Or is it worse if you're eating? Is it different on what you've eaten? If you go in prepared with what's going on with you and as best as you can tell with your body, and then be curious to ask questions. So if the doctor says something to the effect of, have you taken any antacids? Well, the next question ought to be, what is the benefit of taking an antacid? So be curious. because that may not be the best answer. And if you don't ask the question curiously, why would that be a good solution? You won't dive deeper into the root cause. And the doctors, are pushed for time.
Right.
So being curious isn't being disrespectful. It's helping them get you to the root cause to make it less cumbersome later on down the road.
Yeah, I love that. I think that something that you said in there, and I'm a true believer in it, is like the physician and the staff at the hospital, they're all super busy, and no one likes their time to be wasted. And so one thing that you had in the book that I love is, you know what, if you have a certain diagnosis, if you have a certain type of procedure that you're going to have to go through, do your homework. I mean, there's never been a time. I mean, back in 1990 or 2000, you had to go to Britannica Encyclopedia and look all this stuff up. But today it's at our fingertips, and there is no excuse for you and or your caregivers to research that diagnosis, research that procedure, and come prepared with questions. I mean, to your point, the staff, the physician, they will appreciate that. They will respect that. And I think that helps the patient be less intimidated because they have a clue of what the heck's going on.
You're absolutely right. That's a great point because so many patients are intimidated.
Absolutely. Now, one part of the book, and I loved it, and it ties into this. You talk quite a bit about, sharing with the staff, both either the patient or the caregiver, sharing with them, knowledge, asking questions. You talked about a huge turning point within the ICU and catching something because your husband, Bill, was asking questions. So can you share with the audience what happened?
Every patient going into a hospital needs to know their medicines. What are they currently taking? Why are they taking it? What does it look like? Now, when you go into the hospital, they're going to use their own pharmacy, and the medicine may not look the same. And it's crucial, absolutely crucial. I can't emphasize this enough. Don't assume it's the right medicine. Out of genuine caring, ask the person giving you the medicine to explain each one. When Bill was in the ICU that particular day, he was going in for a procedure and had been off his blood thinners for a week. Don't want to be on blood thinners when you go under the knife. One of the medicines that the staff was attempting to administer was a blood thinner.
Oh,
big mistake. Now, Bill just asking, please explain each of the medicines to me. When she said blood thinner, Bill was able to kind of shake his head, no. And she was so appreciative by Bill knowing his medicines, knowing what he should or should not take. They were able to prevent a potentially life-threatening situation when he went in for the procedure.
yeah.
Now, so you'd think that after that happening in the morning, that everyone had been a little bit more on their toes that day. But that evening, they brought him his dinner with cooked broccoli. Now, one of his heart medicines, he was explicitly told never eat cooked broccoli because it negatively impacted the medicine he was still supposed to be taking. So twice in one day, two major things that could have had a detrimental reaction. But because the patient knew his medicines, knew what he was to take and not take, he was able to prevent that. So,
yeah, I mean, know your medicines, know your food, know your interactions. I mean, once again, it comes back to the patient is a part of the team. They have responsibilities. And I do think that, myself included, we all forget the staff in hospitals, they have so much on their plate. They're taking care of so many patients. There are so many different drugs, so many different drug interactions, different types of food. So it's just, they need each patient and their caregiver to be a part of what's going on, to be alert, to help them. And you're right. They won't take it the wrong way. They greatly appreciate it because the last thing they want to do is for the patient to have a poor outcome. So I think that is an amazing story.
There are things a patient can control.
Yeah.
There are some things the patient will never be able to control. But those things, those controllables, asking good questions to research your malady, knowing your medicines, keeping an eye for germs. Now, germs are invisible. We can't see them. But we can control our environment. We do a better job, I think, post-COVID, at making sure everyone's washing their hands before they touch you. Make sure the stethoscope has been cleaned. All these things are controllables that the patient can do. They will feel more empowered by doing it. And it leads to a better outcome, and it relieves some of the pressure off the rest of the medical team.
So I have to step in. I love your hint, and maybe you can get into this. Your goodie bag, and one of them was the wipes, the disinfectant wipes.
Mm-hmm. Bring disinfecting wipes with you to the hospital, and wipe down every visible surface. So the hospital rails, because they have a lot of germs on them. So do your part and take care and clean every surface that you can. Control that they don't think of naturally, and control your words. Remember to say thank you. So use words that are encouraging to others, and you will feel better for it. So that's a controllable. Control your words.
Yeah, I love that because, I told you I used to, years ago in a different role, I was an orthopedic implant rep, and what the physicians do, what the staff does, the nurses, the medical assistants, the people that clean, they are working so hard, and being grateful, and you stress that in your book, means so much. And if you don't think, it's human nature that if you are a grateful patient and a grateful caregiver, you can ask the questions, you can challenge, you can do a lot of things, and they are automatically going to like you and look out for you. And I think that is so important.
And it's easy to show gratitude in different ways. One time I made a homemade chocolate cheesecake, and I brought the entire cheesecake to the nurses' lounge, and I told all of them to please help themselves to a slice of this decadent chocolate cheesecake. And later Bill said, "Boy, I got really good care this stint in the hospital." I just smiled.
Hey, bribery will get you everywhere. Now, I will say, I think that everyone has the best intentions, but sometimes someone's having a bad day. Look, like any profession, you can have a nurse, a physician, anybody that maybe is a little short, potentially arrogant, whatever. So let me ask you a question. What should people do if they feel like their voice isn't being heard?
I love that question, because that actually is what I hear more than anything, is people don't feel they're being heard.
Mm-hmm.
First thing I would say is recognize something from your own vocabulary, that something you're very comfortable talking about. For example, we have horses. I've been around horses my whole life. I know a thing or two about horses. And one time I mentioned to the doctor, and I tried to be, professional. And I said, "Doc, his urine output is pretty heavy." And the doctor didn't listen to me. And I could tell he wasn't hearing me. I turned it around to my vocabulary. And I said, "Doc, he's peeing like a racehorse." I didn't do it to do anything other than to colorfully tell the doctor what my observation was, and so that he could reevaluate Bill and make sure that there wasn't something going wrong. And sure enough, they needed to adjust a medicine. Yeah. And the other thing about that is you don't say it in an angry tone.
Right.
You say it in a way to gain their attention. And most people can speak about something they know about. So for me to use a horse reference was an easy way for me to gain his attention. And it's very intimidating for a lot of patients. From their perspective, they're leaning on the hospitals, they're leaning on the doctors to show them the way, because that's not their livelihood. But this is the thing they need to remember. They have the most to gain and the most to lose. So they need to take a proactive approach. They need to be prepared. If they have the opportunity to know they're going into the hospital, get their ducks in a row first. Because when you do that, then you're more apt to raise your hand and say, hey, wait a minute. No, this is not what we want. This is not what we expect. Please explain that in a clearer language that we can understand. And taking that responsibility and knowing it is your right when you're prepared makes a huge difference.
I agree 1,000%. I'll give you an example, and it doesn't just happen when you're in the hospital. I had a buddy years ago, he had a colitis episode flare up. And so he told me, man, they're going to have to cut on me. And I tell people, look, when you're going to be a patient or you're going to have surgery, don't be shy, don't be embarrassed. You need to talk to people, talk to friends, talk to family, say, have you ever run into this situation? I said, well, what's your doctor tell you he's going to do? He goes, basically, man, he's going to have to cut me from sternum to the belly button and go in and resect and do all this. And I'm like, time out. My brother-in-law just had this done and they did laparoscopic, and you're talking 2 small incisions. I said, look, that physician, he may be a little bit older. He may not know how to do laparoscopic. He may have success with doing much more open surgery, but you need to know that there's alternatives. He talked to my brother-in-law. My brother-in-law told him what's going on. He ended up, instead of a 6-week recovery, it was a 2.5-week recovery. Instead of a huge incision, it was 2 tiny incisions. So you need to talk to friends, talk to family. Look, the physicians are going to do what they know best, but some are trained differently. Some are younger, some are more innovative. And it doesn't mean older physicians aren't innovative, but you just need to look at different options because, to your point, it is you. So don't be afraid. Don't be shy. You need to speak up.
And be clear on your communications. When you were referred out to a specialist, communicate what you're hearing from that specialist back to your primary care provider. That PCP may have some additional insight, if not on the process or procedure you're going through. They could have very tremendous insight to your healing afterwards. Do they provide some therapies, some IV therapies that maybe the surgeon or specialist doesn't automatically provide or even discuss, but your primary care physician might? So that communication doesn't end right with the actual specialist or the hospital.
That's right. And you stole my question because I was going to ask you for any insider tips. And I know that's one you give in the book, that you need to have that relationship with your PCP or primary care physician, that they are super important before the surgery and after the surgery. And to your point, there are some things that they know better than the surgeon, and they know you as a patient better than the surgeon. So I love that. What a great insider tip.
Yes, very important.
When you and I also mentioned, I wanted to mention this, one other insider tip for everybody when dealing with hospitals are the bills. I just had a friend call. He said, I went in for a simple procedure. He goes, oh my God, I keep getting bills. They keep coming from all over the place. So there is a great book out called Never Pay the First Bill, and it is by Marshall Allen. Look, we hear every year millions of Americans are overcharged or underserved, due to the healthcare industry. And look, don't hate the player, hate the game. This is how it's done. But it is a great primer for people to have something to give them knowledge on, okay, I'm going to get hospitalized. I know I'm going to get some big bills. I tell you, get this book by Marshall Allen, Never Pay the First Bill. That will help you at least get yourself on even grounds with the institution that you're dealing with.
And I will add to that because you're absolutely right. In fact, my husband Bill just got a billing from the hospital on something he had pre-approved, supposedly 100% covered, and then a bill shows up. And if a patient or their loved one that's helping them with their care doesn't have that ability to question, and they haven't made the time to read that book yet about Never Pay the First Bill, there are also resources of getting an advocate. And those advocates can specialize in billing. So not an area that I specialize in, but there are advocates out there. I'm going to make a plug for the Greater National Advocates Organization because they have a very easy website to plug this information in and then ask the question, and it'll say, well, these are the people in your area that help with billing.
Oh, I love that.
It will help the healing because that extra stress takes a wear and tear on the body.
Yes, well, that's great. And I don't know if that fills this questions, but as we're wrapping up, do you have one piece of advice from your book that you want to make sure the listeners take home?
Yes. And thank you for asking. Anyone who's going into a hospital, whether planned or unplanned, always have your complete medicine list. So the plan, people say, well, Val, I really know how to do that. I take the list with me. I printed it off and here it is. And the doctors and staff appreciate that. They know you're part of the team to help for a successful outcome. The unplanned, there's a way to get around that too. You have a copy of your medicine list in your glove box. If you're in a car accident, the EMTs on scene might be able to reach in the glove box and see your medicine list so that when you get into that emergency room and they're operating on split-second decisions, they have a resource to help them. So have it in your glove box. Have it on your cell phone. Now, that may or may not always be helpful because if you're incapacitated and someone doesn't know how to get into your cell phone, it may not help. So the paper copy is really helpful. Keep it in your wallet, make a small version. So the number one piece of advice, always have a complete medicine list with you at all times so that if you have to go to the hospital, they can help you the best.
I love that. And I don't think most people would think about that. You need to plan for the unexpected. So all these pearls, we're going to wrap this up, Val. This has been so fun and so just entertaining and informative. So we're going to have a little rapid fire of fun little questions for you. Let's see. What's the most surprising thing you discovered while writing your book?
The most surprising thing I discovered was how involved my faith is in the process. I know I'm a spiritual person and I have my faith, but I didn't recognize how much it was at the forefront of the journey.
Okay, that's awesome. I love that. What is one myth about hospitals that you love to bust once and for all?
They're not as clean as you'd think they are.
There's a call out to them. Okay. So if you could put one poster on every hospital wall, what would it say?
I'm listening. You're not alone.
I love that. Okay. What is the first word that comes to mind when I say hospital cafeteria food?
Inedible.
Those poor people eating there every day. So Val, with that, I just want to thank you so much for sharing your insights today and also to Bill for allowing you to share the journey that he took with you. Your book, Surviving the Hospital, 6 Secrets Every Patient Should Know. It's such an empowering resource for patients and families. And I think that listeners are going to walk away feeling much more confident the next time they or one of their loved ones is in the hospital setting or in any acute care type setting. For anyone who would like to get your book, Surviving the Hospital, 6 Secrets Every Patient Should Know, distribution outlets, and I'll also have in our show notes that you can go to Val's website at www.hospitaltohealth.com, and that will be in the show notes. I want to thank our audience for joining us on Disruptive Dialogue. We try to share pertinent information, compelling stories, people just like you and me that are trying to get through their daily lives in the healthcare system in the U.S. Val, you're given so much back, and so is Bill, by sharing your story, sharing it in a book, all your best practices. I want to thank everyone out there. If you get a chance and you like this podcast, please subscribe, please hit like, and please share it. This is Chuck Melendi. Thank you, Disruptors. Have a great day.